Hyperacute T waves can be the first manifestation of a STEMI, and they can present within the first 30 minutes after. The problem is they aren't very specific. It's very unlikely that a patient will be taken to cath lab based on the finding of hyperacute T waves alone. To start off with, we'll look at what a normal T wave should look like. So the T wave normally is positive in a lead where you have a positive QRS complex, and this is because a wave of repolarization occurs in the reverse direction. So it happens from epicardium to endocardium. So the normal T wave is slightly asymmetric, positive, and it is relatively small with respect to the QRS complex. Whereas in the case of a hyperacute T wave, you can see here that this T wave is pretty large compared to the QRS. It doesn't necessarily have to be tall, but it does have to have a wide base. You'll also typically see a loss of the asymmetry that we spoke about before. So moving on to T-wave inversions. A T-wave inversion is the presence of a negative T-wave deflection in a lead where the QRS is predominantly positive, or you have a predominant R wave. So in the case of V1 or AVR, where you would usually have a negative QRS complex, a negative T wave is not a T wave inversion. We often also see negative QRS waves in leads V2 and also lead 3. So in these cases as well, if you have a predominantly negative QRS complex and a negative T wave, it's not T wave inversion. Like ST depression, T wave inversions are a relatively non-specific finding, and a real T wave inversion, what it represents is abnormal ventricular repolarization, which you can also see in other conditions like left ventricular hypertrophy, for example. The other issue is that it can present as a normal variant. Some athletes, some black people will have T-wave inversions across the precordial leads, and this can be a normal variant. But we're going to talk about this when we talk about ECG changes in athletes. What's important is that the presence of symptoms and dynamic T-wave inversions that are getting deeper, or perhaps they were positive and now they're negative, say for example in the lateral precordials V5 and V6, that should increase the suspicion for ischemia.